Chairman of the Finance Committee, Senator Baucus, has indicated that he will schedule a vote in the Finance Committee on reporting the Finance Committee developed bill sometime in the next few days. That would then come to the Senate floor, or not directly to the Senate floor, but it would be merged with the legislation that has already come out of the Health, Education, Labor, and Pensions Committee that I also serve on. And the combined product of those two committees will be brought to the Senate floor sometime in the next few weeks. Well, the legislation is comprehensive. It tries to reform our insurance markets by requiring that the companies selling healthcare insurance in the future would have to make those policies consumer-friendly in various ways. They could not preclude pre-existing conditions or coverage as a result of pre-existing conditions. They could not put annual limits on the policies or lifetime limits. They would have to include preventive services with very modest, if any, co-pays involved with the preventive services. So there's a lot of very good provisions on that. The legislation also expands coverage to many people who don't currently have coverage. It expands coverage under Medicaid as well. And it sets up a system whereby there's federal support provided for folks up to 400% of poverty to help them cover the cost of the insurance that they would be required to obtain under this legislation. Well, I think that we've had many months of deliberations about the legislation. I have focused primarily on the issue of affordability, and that is, we don't want to require people to buy something they can't afford to buy. I've also focused on the issue of being sure that the coverage that people got through insurance, when they obtain a policy, is adequate to meet their health care needs. That's a big problem that we have. We have the uninsured, a lot of people with no coverage at all, but we also have many people, unfortunately, who are underinsured in that they have policies that have such a large deductible or such a high copay that when they get sick or when they need health care in a significant way, they find that their policy doesn't cover much of what they need. We did not, the Finance Committee did not have the votes to add a public option to the bill that is to be reported out of the committee. There was a proposal by Senator Rockefeller to do that. His proposal would have tied the reimbursement of the public option to Medicare reimbursement rates. I supported that. I expressed my misgivings about the idea of tying it to Medicare rates for providers. But Senator Schumer then offered another version of a public option, which I supported as well, and it did not tie the reimbursement rate to Medicare rates. I think that's a better way to go. There'll be another effort when we get to the Senate floor, I'm sure. Either the bill that comes to the Senate floor will include a public option because the bill coming out of the Health, Education, Labor, and Pensions Committee had a public option in it, or we will see an effort made on the Senate floor to add that. Well, the Congressional Budget Office says that this legislation is fiscally responsible. It does reduce the deficit for the entire country, for the federal government, over the next 10 years. They estimate that the savings that would be achieved and the revenue that would be generated through the legislation would more than offset the cost of expanding coverage to people who currently don't have coverage. The estimate is that there are about 29 million people that would get coverage under this legislation who otherwise would not receive coverage, and that would leave about 25 million in the country by 2019 who would not have coverage. About a third of those 25 million are undocumented immigrants, and they are not entitled to coverage under the legislation. So the bill, I think, is responsible, fiscally responsible, and responsible in a budgetary way. Senator Reid, who's the majority leader, will now take this legislation, combine it with the legislation that's come out of the Help Committee, and bring a combined package of legislation to the Senate floor. That will take a few days or maybe a week or so to get ready to go. But I hope that by mid-October or shortly thereafter, we will be in a position to begin a serious debate in the Senate on what should be in a health care reform bill. Thank you for continuing to watch our PolicyCasts, and please look at our website if you need any more information on any of this. It's bingaman.senate.gov. We have a lot of links to different sources of information for you there. Thanks again.